Thank you for joining us today for Elevate the Employee Experience in 2018 with Innovative Population Health Management Strategies. This webinar is being offered with a 1 professional development credit for SHRM CP or SCP. I'm Cara Tarantino, the Vice President of Marketing with Orthis Health, and I'm thrilled to be presenting today with Chris Perry, our Director of Clinical Services, who has vast clinical nursing and population health management experience. Today, we're going to take you on a little tour of what the employee experience is all about, why this trend is gaining momentum, and what's in it for you and your employees, how creating a culture surrounding the employee experience can impact your efforts in improving population health management and help grow your culture of health as well as your culture of analytics. We're going to look at strategies to help engage your employees in healthy behaviors and how developing an employee-centered culture can lead to even more personalized pathways to changing and improving health. We'll look at scientific resources and digital tools that can help improve health and well-being by their ability to pinpoint risk and what we can absolutely do something about. Also, what's working, as well as fruitless areas we could be spending too much time on when our efforts might be better focused elsewhere. Then let's see why senior level support is crucial to employee engagement, personalizing the employee experience and improving population health. First, a little background on Orthis Health. We are pioneering new pathways for population health with the goal of improving the overall employee experience. What that really means is we create unique pathways or roadmaps to change for every individual based on the data we gather and analyze from our Know Your Number disease risk tracker, biometrics, medical and pharmacy claims, coaching stats, and population health reporting, among others. We have a comprehensive wellness solution, but it's in our ability to direct individuals along a path created uniquely for them and get quantifiable results that sets us apart. As we affect positive change and personal growth, we elevate the overall employee experience and can actually help improve the relationship employees have with their employers. Our target is always win-win. Forbes said that 2018 would be the year of the employee experience. We're familiar with the word experience from the patient experience, where years ago, hospitals started calling patients people and making environmental improvements like changing fluorescent overhead lighting in rooms to more comfortable, subtle lighting, pumping new aromas throughout hospital corridors to mask clinical smells, and respecting a person's dignity with gowns that don't easily flop open in the back. Hopefully that's true. Today, 90% of companies compete based on the customer experience. Retail stores now have Starbucks. One-click checkouts make your online shopping experience quick and easy, among others, all to create pleasurable environments and experiences where it's easy and comfortable to spend time and money. It's no longer enough to pay attention only to patients and customers. So we move on to the next competitive frontier and what we call the employee experience. What exactly is the employee experience? The employee experience is the sum of all the interactions an employee has with an organization. It's not about what happens to an employee, but about their perceptions about what has happened. The employee experience can be good or bad, positive or negative. It is the sum of all processes and events that an employee has with their employer, from their first contact to their final interaction. Mark Levy, the former head of the employee experience at Airbnb, sums it up well. The employee experience is anything that sets the employee up for success and improves culture. And Richard Branson's philosophy regarding the employee experience is nicely summarized in this quote. If you can put your staff first, your customers second, and your shareholders third, effectively in the end, the shareholders do well, the customers do better, and your staff remains happy. Artificial intelligence and machine learning are driving a data revolution where HR can benefit. We now go beyond employee engagement surveys and use AI to collect more employee data, including behavioral, emotional, and attitudinal insights. In 2018, we will now be able to collect not only explicit data on the employee experience, but can begin to leverage new data sources that provide implicit signals of underlying attitudes and emotions. Highly engaged employees help grow revenues as much as 2.5 times more than employees who are not engaged or just barely. The correlation is so clear between engaged employees and improved financial performance that companies are seeking to connect employee data with customer experience data. How does a person's current health status and their ability to address their own health issues and improve upon them impact a company's financial performance? With highly effective companies, those seeds are planted deeply in culture and are at the core of population health innovation. So with that, I'm going to pause here and segue to Chris, who will take us on a journey about planting those seeds as he explains more about the value proposition of population health. Chris?
Thank you, Kara, and thank you to everyone for joining us today and learning more about population health management and how it can elevate the employee experience. I've had the pleasure, the distinct pleasure of working for more than 20 years in healthcare, and I look forward to talking to you today about what you can do to elevate the employee experience at your place of employment. Let's talk about population health. Population health management is a complex and sometimes vague concept that is evidenced by the variety of search results that will be returned on a web search for the term population health management. Let's talk about what it actually is. Population health management is the application of management strategies to improve the delivery of healthcare for populations with an emphasis on achieving the highest quality of care at the lowest cost. Now, let's break it down a little further and look at our populations. Populations can be our national population of the United States, your state's population, your county's population, all the way down to an employer population. And that's where we're going to mainly focus today. Population health management overall has a triple aim. The triple aim was developed by the Institute for Healthcare Improvement, or as we know it, IHI. The triple aim is a framework for optimizing health by improving the patient experience, improving the health of populations, and reducing costs per capita. As we move through the presentation today, I want you to think about your populations, your employees, your workforce, and your community. Many of us on the line are familiar with core measures. Population health management has a set of core measures developed by the Institute of Medicine back in 2015. I'm going to name off just a few of these today to get your mind wrapped around of what we can track. So some of the things we're looking at is life expectancy, well-being, overweight and obesity, which Kara is going to cover much more in detail later, addictive behavior, healthy communities, preventative services, personal spending burden, population spending burden, individual engagement, and community engagement. These core measures were developed to have a systemic reach and be outcomes oriented. They're intended to be meaningful at a personal level, and like Kara said, elevating the employee experience. There are several population health management approaches, and I just want to touch on two of them today, just briefly. The two approaches I want to call out are hot spotting and cold spotting. Hot spotting is a population health management approach that involves identifying population groups with particular areas of need and developing interventions to address those needs. Cold spotting, on the other hand, is a population health management approach that involves identifying population groups who lack access to healthcare and other community supports that influence health. When thinking about hot spotting, one real life example that I've had comes to mind. Years ago, I was serving as a chief nurse in a hospital for a rural hospital in the southeast part of the country. This workforce is primarily based on manufacturing in the town. With this came certain areas of need, primarily being overweight and obesity, without a solid education on healthy eating and healthy eating habits. Thinking about cold spotting, another example comes to mind. Serving as a hospital executive, I worked in a very rural area, and again, it lacked education about healthy eating and wellness, but more importantly, they lacked access to primary care, and that was a major challenge for everyone. The community would use the emergency department as their primary care provider, and we all certainly know what happens when this is the case. The ER is faced with a constant backlog. Emergency care, even at baseline, is extremely expensive, and by the time someone reaches us, they're already sick. There was no prevention, no education, no preventative care, no wellness education at all. This resulted in very high claims for the employers whose employees use the emergency department. This then places a burden on the insured, and in turn, this rolls back to the employer with higher rates for health insurance year after year, cutting into margins. With increased premiums that employers are going to pass on to employees, employees are less likely to sign up and enroll for the appropriate insurance. Then the cycle continues. The domino effect here is very easy to see. This is negatively impactful to all. Overcoming these challenges typically requires the education, engagement, and interaction of key stakeholders. Senior leaders must understand that an employer can do everything right to influence the health and productivity of its workforce at the work site. But if the same workforce lives in an unhealthy community without health education and wellness care, employer investments can be seriously compromised. Population health management with wellness programs that lead to improved health have identified great benefits that include attracting and retaining talent, more engaged employees, greater performance, improved personal safety, sustainability, and improved brand reputation. And we all know that brand reputation is something you just cannot put a price on. All of this elevates the employee experience. Employee engagement is the key. Educating and empowering employees with the right tools and education will lead to success for the employee and success for the employer. Combining the right resources in a way that is meaningful to your employees will let them take charge of their own health. Combining the resources such as data programs and tools that will give the employee necessary resources to succeed in meeting their individual health goals. Emphasizing healthy behaviors on an ongoing basis through education, healthy competitions at the workplace, and results-oriented programs will slowly change unhealthy behaviors to desirable behaviors such as eating right and exercising more, which is very simple. When an employee completes a health risk assessment with biometric data, their eyes are open to their own health status. Health risk assessment can give accurate information of where the employee needs to focus on their health goals, and being able to trend this year over year can demonstrate an employee's commitment to improving their health. When the employee has an opportunity to review this health assessment with a health coach, the education and action process begins to improve health. Many employees do not think about improving their health while at work. Expert health coaches can discuss activities such as low-impact exercise at your desk, incorporating yoga into your daily work routine, getting up from your desk each hour and moving around the office. These changes can only improve healthy behaviors but lead to more engaged, well-balanced employees. These healthy habits can be reinforced through health and wellness coaching programs to keep the employee on track and motivated to dedicate themselves to changing their lifestyles and improving their health. It is imperative to get senior level buy-in to implement a wellness program in the workplace. This frequently requires education, engagement, and the interaction of key stakeholders with the goal of a commitment to process improvement. Committed senior leaders have a desire to improve the health of their employees for many reasons. Most importantly to them, a return on investment by improving the wellness of their employee population. Think of the senior leaders that you interact with and how they might currently view proactive wellness. Evidence-based data is the key. Nationally vetted wellness data applied to biometrics and identifying an individual's views on wellness, along with their readiness to change behaviors, is the catalyst for successful population health management wellness programs. Think of the seen in health outcomes in the United States. Mortality and morbidity vary greatly, and this is often due to three major factors, any of which could lead to an adverse health outcome. They are social and economic factors, clinical care, and most importantly, health behaviors. Social and economic factors can be the level of education of the individual, the type of employment, the income, family and social support, and community safety. Clinical factors can include access to care and quality of care. Again, the major influencer of health outcomes is healthy behaviors. I want to name a few of these behaviors that are adverse so that you can see them. Tobacco use, diet, exercise, alcohol use, all of which are modifiable health behaviors. The combination of prospective and retrospective data will give employers powerful data and analytics. This data will demonstrate your current state, but also the state in transforming your unique population. Combining the right scientific resources, such as predictive modeling, with a wellness program can lead to improved outcomes, improved health, and lower costs for employers, leaving them with a strong return on investment. And in today's digital age, high-tech risk assessments, health platforms can empower employees to change modifiable behaviors. Employees can be more informed of their current health status, trend their wellness and biometric data over time, all of which can lead to improved health for their employee population. Combining these high-tech assessment tools and platforms with high-touch health coaching can truly provide the most impact. High-tech solutions and high-touch health coaching and education leave the employee with the data and motivation they need to change modifiable health behaviors. As a comprehensive wellness solution, digital tools, data, and platforms combined with, again, high-touch health coaching is what we consider to be the secret sauce. Let's talk about health coaching for a minute and what it is, briefly, and how this invaluable high-touch service can keep your employees on track and provide the necessary motivation and education to reduce disease risk. Health coaching is an effort to engage people to modify their behaviors and address their own health risks. Health coaches are truly invaluable resources for your employees and their families. In today's world, employees can engage with their health coaches via mobile app, phone, in person, or via email. As part of a wellness program that drives population health management towards lower disease risk and healthcare costs, health coaches are the key. They not only assist individuals with high-risk health factors, but they also assist moderate-risk individuals to lower their risk, and the people that are already healthy to remain healthy. Health coaching, with its proactive approach, assists employees before they become a claim. In contrast to programs that focus on managing a specific disease or condition, a whole person model of health coaching addresses all of the individual's risk factors. Health coaching can be short-term and long-term and tailored to the individual's specific need. Health coaching can have different aims and tailored to that of the individual. Coaching can revolve around incorporating new healthy habits in their routine, to exercise coaching, disease management coaching, and coaching to track their wellness progress overall. The expert knowledge of the health coach is imperative and invaluable to the employee, focusing on proven strategies with no gimmicks, while providing the employee with the tools necessary to take control of their own health, weight, or disease process will lead to long-term improvement of the health of your population. This is done by lowering costs and improving your return on investment and the health and wellness of your employees. A whole person coaching program guides each participant to focus first on the changes that he or she is ready to make, rather than comply with a set of behaviors that he or she is not contemplating practicing. To meet wellness goals, the health coach guides participants to find their own motivation, break through barriers, cultivate the support they need, and encourage employees to maintain progress when goals are achieved. To wrap up my portion of the presentation, I hope you can see that population health management and wellness programs truly can assist individuals to an improved level of health and leave the employer with a strong return on investment and a happy and healthier workforce. All of this elevating the employee experience. Kara, back to you.
Great, thank you so much, Chris. Now it's time to take Chris's valuable information about population health and put it to use in elevating the employee experience. How do we as employers take population health and the objectives we have for employee health and outcomes and make it an integral part of the employee experience? We need to weave health and well-being, physical health and disease avoidance, work-life balance, financial fitness, effective sleep, stress management, and more into the equation to deliver the metrics we're looking for. So let's look at some of the ways. If you want health outcomes, you need to invest in evolving into a culture that supports healthy behaviors, really with 99% uptime. Do you provide the right resources that transcend wellness? And you only know what you can see. What about data you need to see but can't? Looking at your data prospectively, future and retrospectively, historical views, can provide insight needed to implement the right strategies and interventions. We are not moving the needle on weight, a challenging issue for us individually and collectively. Do you have a no-nonsense ongoing program that if an employee follows and completes the program, they will see results? And support. Is it reliable, consistent, long-term, where employees can count on the right type of support being there all the time? Each one of these items needs to be carefully considered and then implemented. So Chris mentioned a number of factors that contribute to healthy outcomes. Today we'll look at those health behaviors that can be changed, what employees can be held accountable for, and most importantly, how those changes or lack of change can impact a person's health and risk for disease, and how these changes can impact the bottom line ultimately. And again, we know what we should do and we know what we shouldn't for the most part. We know there are modifiable habits we can and should change and those we can't. But what we don't know but need to find out is how each of these habits that are in our control to change contributes to our own unique risk for chronic disease and what our own unique pathway to change looks like in order to avoid chronic disease or the progression of disease. As you can see here, it's important to give employees the knowledge they need about how their modifiable habits contribute to the conditions that give rise to the overwhelming cost of chronic illness, the costs that we bear on both ends as employees and employers and other risk bearers. This is the start of creating a unique pathway to change for every individual that we will dive into shortly. Preventing movers from a low risk level to a higher one is well worth our time, energy, and money. The costs of an individual with a precondition are much less than one with a disease. For example, an individual with prediabetes will cost about $4,300 a year. But if that person develops type 2 diabetes, those costs can increase to over $13,000 a year, according to the American Diabetes Association, and not taking other conditions or complications resulting into consideration. Typically, medical expenditures for a person with diabetes is 2.3 times that of a person without diabetes. According to the CDC, almost 34% of the US population has prediabetes. And a study in the Lancet several years ago revealed that without any intervention, 10 to 15% of a given pre-diabetic population could have type 2 diabetes within 2 years or less. Wellness and well-being programs are an important part of the employee experience, but whether or not they are working for individuals and or worth your time and investment is a whole other matter. That may sound strange coming from a wellness provider, but what we are really seeking is to go beyond wellness, to transcend just offering programs for the sake of having them by combining the right resources to come up with the right solutions. Data-driven programs are more effective than those that aren't. Data analytics that offers both prospective and retrospective views on data enable us to not only have a current snapshot of health and disease risk, but enable fluid ongoing analysis as well. It is this type of analysis which helps us make realistic recommendations that employees and employers can act upon. Digital tools are a hot commodity now, but they are used more effectively when members know their history, have the ability to look in one place and see their current risk score as well as historical risk scores. Digital tools are used more widely when people understand the importance of tracking and monitoring and what changes in their numbers mean. They need to be able to do this in real time and over time. Going beyond wellness helps us look at offering more personalized support, services, and the right combination of the right programs based on risk at the same time. Weight, for example, impacts a number of conditions, and an individual may need to be on a prediabetes intervention or a diabetes management program at the same time as a weight loss program. Does your current well-being solution offer you that option? Developing a full health risk profile is important. It's important to look at disease prevention, but to also focus on assessments, data, and support that can lead to developing a more in-depth health risk profile, one that includes chronic disease risk along with safety risk. Coaching can transcend what we consider typical lifestyle coaching today to consider job function, environment, relationship types, dealing with difficult colleagues, and more to offer even more effective support. Wellness and safety in some organizations are still siloed, but that's beginning to change, especially in the face of rising musculoskeletal claims, which, by the way, are 50% of all claims today, number 3 in the top claims costs, and it also pains me to say 70% of those claims are preventable. So let's dive a little deeper into why prospective and retrospective data analysis helps you see what you need to see in your data but can't. It's like looking at a flat map on a wall versus a globe when planning a trip. Your perspective changes significantly even though you're still looking at the world. The depth and breadth of knowledge and understanding changes when you can see past, present, and future data. It is this fluid worldly analysis that will help you plan for more effective interventions that will prove to be more engaging to employees. And let's not forget about gaps in care. If all we did was focus on age, gender preventive screenings and centered our incentives and communications along those lines, we would see big cost savings and even save some lives. Using data effectively is a smart people strategy. In seeking high levels of engagement with your programs, the means or experiences by which you seek to engage employees must be relevant and personalized in order to work. In other words, the data needs to direct employees where they need to go personally in order for them to follow and complete the path. It is this path that will ultimately lead to lowering risk and ultimately costs. Developing a unique and personalized pathway to improve health for each individual involves an understanding of risk. You are most likely familiar with health risk assessments, as Chris addressed, or what we call HRAs, but may not be as familiar with disease risk trackers. Both are questionnaires regarding lifestyle behaviors that are often paired with biometric screening results to produce a report on health risk and provide some sort of risk score. Most standard HRAs are statistically based and provide a good enough assessment of health risk. But a survey of large self-funded employers revealed 50% think they are a waste of time and money and are skeptical about whether or not employees are truthful in answering. Disease risk trackers, specifically the Know Your Number, disease risk tracker is a scientifically proven model that identifies an individual's risk for 6 chronic diseases, pinpoints modifiable risk factors, and how each of those risk factors contributes appropriately and individually to each chronic disease. It assesses risk according to peer group, and when combined with biometrics, gives an overall individual disease risk score. Of note, Know Your Number is based on a predictive model called synthesis analysis that has outperformed the original Framingham score model because in part of its ability to include new risk factors that were unknown when the Framingham heart study began in 1948. I'll give you an example as to why this is important. Let's say we have 15 risk factors for chronic diseases that are already included in our risk model. We know what they are: weight, exercise, blood pressure, etc. Hypothetically speaking, if peer-reviewed medical journals report this year on research that has been done proving there is a correlation between having long wavy hair and an increased risk for heart disease, we can add hair type to our disease risk tracking model. That's exactly what happened over the years when exercise, for example, and among others, was discovered to be a risk factor for many chronic illnesses. Exercise was incorporated into the risk prediction model. If hair type, color, or length proves to be a significant contributor to a person knowing whether they are at risk of developing a disease, wouldn't you want that to be part of your screening tool? In developing a unique pathway to change for each individual, we would want our model to report that cutting your hair would help improve your overall health risk. This may be a silly example, but then again, we don't know what we will uncover tomorrow. But the point is, you don't want to ever be using an outdated model, as this would make the risk projection inaccurate as well as any cost projections. So when an employer or broker tells me an HRA is good enough, we have evidence to support the fact that it really isn't. And we need to use available tools that are not only precise, but also current and scalable. Weight, among others, is a risk factor in our model, so we can accurately pinpoint just how much being overweight or obese contributes to the risk for disease. And because we know which diseases it affects and by how much, we can also determine the impact of even subtle changes. Tracking and understanding disease risk is important to the employee experience. When we talk about the means by which we engage employees, we need to include the data sources and identify the action or steps needed to get results. Employees need to track their own data over time. They need to understand their own history and all the numbers that go into their personalized score and what they can change that will cause a subsequent change in their risk score. They also need to see in black and white how responsive the small incremental changes they make in their health can change their risk score. In other words, their disease risk score needs to be highly responsive to impact their engagement in any activities or programs. It's this type of engagement that will factor into their overall employee experience. The reporting we provide through Know Your Number points to what employees can act upon. It offers a personalized action plan or pathway to change, and that plan is unique to each individual. Each person needs to understand the role each modifiable risk factor plays in their overall health status. This is powerful information when presented clearly and simply. An employee might ask, you mean if I reduce or change this one risk factor like smoking, it can impact my other risk factors as well as my risk for certain diseases? The visual representation of personalized data is highly effective in jump-starting readiness to change. Ideally, we want to halt the progression of prediabetes or reverse type 2 diabetes. Here's one example of how we create personal pathways for each individual to change risk and impact future costs. The data leads us to implementing the right intervention. Once we have identified through Know Your Number and biometrics who has prediabetes, we look at all the modifiable risk factors: weight, waist circumference, glucose, exercise, etc. We look at the costs of prediabetes versus diabetes and determine the right interventions based on the individual's personal health and disease risk profile. If a person needs to lose weight to lower diabetes risk, coaches work with the individual to ensure program adherence and can adjust or make recommendations for other programs based on that individual's progress and the ability to complete the program, which we know is a big deal. With behavior change, as well as adhering to the program and closing any gaps in care, we can effectively alter an employee's personal path and establish newer ones that give them additional opportunities to make other important lifestyle changes. Because it's so important we have the ability to develop personal pathways to change for every individual, I want to show you another example, this time with a different data source and a different path. This pathway is for an individual with diabetes and the role of medication compliance. In this example, we want to ensure a person with diabetes adheres to evidence-based rules for taking medication because, in addition to the physician prescription, the science tells us it works. We pinpoint the care gaps, an intervention with incentive is provided, and the health coach works with the individual to support the physician and clinical care. Once medication compliance is achieved, we close the care gap and effectively alter the personal pathway. When you look at your goals for your wellness program or any other interventions you're offering employees, see if there's a clear pathway to change. See if each step along the way can be addressed to get the results you expect. While there are many elements that go into this pathway, it's helpful if you get the plan, support, tools, reports, and recommendations from one source. Most employers want control over their financial futures and know population health tools and employee engagement and effective wellness programs can get them there. As employers, the data can show us our population's health risk, new cases of disease that can be avoided, and the costs that will most likely be avoided in the future. The tricky part of the whole equation is knowing if the investments we are making in employee health and wellness are paying off. This is what we all want to know, and with the right scientifically proven resources and our ability to use data the right way, we can now clearly see what's working, what isn't, and change our plans accordingly. Let's also look at claims briefly, as this is important for our prospective and retrospective data analysis. Do you know where your high-cost claims are coming from? Do you know why those claims are changing and what the correlation is to disease risk and what can be prevented? Are you able to query your claims data to understand how you can take action on it to introduce targeted interventions and communications for your population? So let's ask Siri a question about our data. Hey Siri, how do I know if my employees who have diabetes and a BMI greater or equal to 34 are costing me more than those with diabetes and a BMI less than 34? As we know, Siri's pretty smart and says only Orthis Health's query tool can tell you how much you're paying for each group. Good to know, Siri. So Siri's letting us know what you want to be able to see in your data that you're currently not seeing by asking the right questions to know your current costs as well as future costs. Another question might be, what is the correlation between obesity and MSD claims? What is the cost of diabetes medication non-compliance? Maybe you're a health system and want to know if your employees are using your competitor's service instead of your own. Do you know where the place of service is? This is something you really need to be able to ask of your data. It's important we mind the gap and make age, gender, preventive screenings a priority. And there's a lot you can do with communications that educate on their purpose and value. If you look at your claims costs for preventive screenings, colon, prostate, breast, and cervical cancers, you will see many who just simply aren't getting them done. You can also see via claims in this colonoscopy example, the overall screening participation rate from year to year, the number of individuals that had a polyp removed, as well as the number of cancer diagnoses most likely as a result of the screening. Do you know what your claims are for these types of cancer where preventive measures and screenings work? Is communicating the value of these screenings a part of your population health management objectives today? If no, why not? Another area that demands our laser focused attention is weight loss, a serious, committed, sustainable, no gimmicks approach. Employers need to be in the weight loss game long term. We need to look at weight loss as one of the key factors in preventing risk movers. Aside from some of the other obvious benefits, weight loss improves our coping skills. When we improve our coping skills, we become more resilient, are able to build better relationships, mend fences better, all of which translates to increased productivity and happiness. Some of this information may not be new to any of us, but I wanted to call out a couple of challenges we need to address. In this October 31st survey in the journal Obesity, only 50% of those who are obese actually see themselves as obese. That in itself is a challenge. Then, as we focus on driving our employees to primary care to increase prevention, reduce ER use, and more, we see that only 28% of healthcare providers even see it as their job to counsel on weight loss. That's a low percentage. So if we're thinking primary care is a catch-all for all the issues that plague employee health, we need to think again. Our medical schools don't train physicians to be weight loss counselors. And then only 17% of employees even see employer-sponsored plans as helping with weight loss. Together, there's a lot of opportunity here to put sustainable programs in place that work. If that isn't enough, obesity coupled with our aging workforce adds up to poor muscular strength that is increasing our workforce's risk for injury and disease. We are seeing reductions in shoulder and knee strength, and even many back issues are actually shoulder injuries. The difference between an individual with a strong strength to BMI ratio versus a weak one is significant. That is what's affecting our high musculoskeletal claims. So implementing health coaching, injury prevention, and safety interventions is a smart idea. Our buddy Joe here is healthy but obese. And even with normal blood pressure and normal cholesterol, his cost to society is $36,000 based on his age at about 51. So that cost varies according to age. But his struggle affects everyone and impacts all of our health premiums. Joe's engagement with his health also impacts your success as an employer. He needs to be accountable for his own health, but he can only do that with the relevant data he understands that includes a clear pathway to change or action plan. We want to visually articulate his biometric risk factors, his overall risk for disease, his modifiable risk, and also his risk compared to peers of the same age and gender. That is when reality typically sets in. Seeing how his risk stacks up to peers is usually an eye-opener. Because we're having such a tough time impacting weight, we've identified tools and support necessary for effective weight loss, and we do this through our First 5 weight loss program. But we don't want to just throw things at these individuals. We want to personalize our approach based on your organization, culture, employee demographics, risk scores, and objectives. We want to start simply and introduce new resources as needed based on the individual, their comorbidities, and what they want to accomplish. They will need all of these things at some point in their weight loss journey to meet with long-term success. And then our 5th strategy is to line up reliable long-term support for preconditions, not just overweight and obesity, disease management, and for other life issues people deal with in their daily complex lives, like stress, loss, grief, difficult relationships, lack of sleep, and more, all of which impact the employee experience and how employees not only perceive work, their employer, but also how they approach life and their outlook on life. Everyone needs support on different levels at different times based on their own personal journeys. We need to be sensitive to understanding what employees are saying about what works for them and what doesn't. And we need to give them the ability to see changes in their risk scores with more than yearly assessments when possible. Recognize that making change is hard up front. Recognize we all need to change. Connecting to employees while respecting their privacy is considerate. Know what employees are thinking and concerned about. These are real questions employees ask often. Can I make time for myself? What is really important to me personally? How much do I need to do to make a difference? That's a big one. Will it take long? Another big one. What difference can I expect to see in other areas of my life that are important to me? Is the sacrifice worth it? And reinforce that small changes add up to big results. I am so proud of our members and their ability to step up and share their personal journeys and stories to help others. It's important to know how and why your employees are meeting with success. We interview many members and write their success stories, and I collected what they all have in common here. As you improve your employee experience, this list will grow. It will expand to include perceptions of the value your company brings to their lives, personally and professionally, based on the strategies and programs you implement. This will in turn affect attitudes, spirit, contributions, and more. Health and population health and a positive employee experience are clearly all about balance. Employers want productivity, performance, and returns, and employees want to feel autonomous, have mastery, and purpose. Here's what we need to better balance the employee-employer seesaw. The most important one being, don't ever give up on your employees and their ability to improve their health and quality of life. How are you communicating with your diverse audiences? Are your communications fresh, relevant, interesting, consistent? Do they inspire and make sense and speak to people on the level at which they are able to process and retain information? I should say receive information first, then retain it. It's easy to have a lot of communication that never sends the right message or reaches your intended audience when they need it. In addition to newsletters and webinars and more detailed information for our members, we like to send out brief, fun health tips on a regular basis, weekly mainly, on a wide variety of topics and customize them based on client demographics, employer type. Get feedback on your communications so you can make them more effective, especially when you want and need employees to take action as a result. If the employee experience is all about the perception employees have about your organization and their experience, maybe it's time to change some of our language. In wellness speak, we talk ceaselessly about incentives, participation, and engagement. Those words won't go away, but they do fall on deaf ears often. They don't promote a culture of inclusion, but rather one of exclusion by pointing to those who need certain services as well as those who don't. To begin to address the employee experience, maybe we need more emphasis on inviting people to join because we all benefit when each individual improves. We need to include employees in the big picture, the reason we are all here, so they know they are important to the greater good and feel like their unique contributions matter greatly. And if we focus on the total employee experience from start to finish, we will see engagement take on whole new meaning. Weaving in new positive words that are more inclusive and less exclusive can make a difference. And finally, a positive employee experience adds up to positive, sustainable growth for everyone. Individuals and their families, employers, partners, vendors, shareholders, we all benefit. Chris and I thank you so much for your attendance today. I'm always thrilled when we can end before the hour and give you time before your next meeting. We covered a lot of information and we welcome the opportunity to discuss your needs and challenges as a result and would love to have you join us again on future webinars. Our webinar next month will focus on data and claims analytics and why revealing unseen data is so critical to managing employee health risk and your healthcare costs. We'll also be following up with each of you to send you your SHRM certificate of course completion for your professional development credit. So I thank you so much for your time today. And as always, we'd love to hear your feedback on the value of the webinar and what topics you'd like to see in the future. So thank you so much.